And we believe that no one should die when giving life to another person.
And the challenge is mostly on the family planning. A teenage pregnancy. A lot of children do drop to schools.
Where people have to cover long distances to reach the health centers or the health facilities.
Pregnant women are not able to access the services that they are needed.
There are still women who are not going to the hospitals to deliver because of cultural beliefs.
It's a success story, and there are so many innovations we can take back home for these countries we support that they can implement also to ensure that the lives of our women and their children are protected. We give them healthy life and make sure that they live to fulfill their reproductive health rights or needs.